Greetings. Today is August 4th, and this is your COVID-19 update. The Good Samaritan Center continues to address positive cases of coronavirus among the residents and staff. To date, there are 4 confirmed cases of the virus among the membership. 1 is in the hospital and 3 are at Good Samaritan Center. The residents here have been isolated in a separate area, and they are being served by staff dedicated to only that unit. The residents were all tested earlier in July, and all those tests came back negative. Yesterday, August 3rd, the Department of Health retested every resident. The results are expected back in 3 to 5 days. The staff of Good Samaritan Center and Dossier Manor continue to be tested every 2 weeks. The results from the most recent test came back, and regretfully, 10 additional staff members have positive results. These employees are isolating at home and will not be able to return to work until cleared. The Department of Health has been working closely with the staff during this challenging time. Moreover, a team from the VA has been assigned to Good Samaritan Center to provide additional support. We are grateful for this extra assistance, and they are helping to ensure quality, loving care continues for those we serve. There are also 2 residents in independent living who have tested positive for COVID-19. Both of these cases were previously reported, and both individuals remain in the hospital. Out of an abundance of caution, several residents who have had close contact with these residents or other known positive cases have been asked to self-quarantine. None of these individuals that we are aware of are exhibiting signs or symptoms of the virus. At the present time, we have 1 employee in independent living who is also out because of a positive COVID-19 test. Several other employees have been asked to self-isolate due to close contact with a person who had contracted the virus. None of these individuals will be allowed to return to work until cleared. As we see an increase in number of cases among the membership and staff, let me remind everyone that rumors are not helpful. Our goal has been to keep the community informed through these updates, and we will continue that effort. Please understand that everyone admitted to the hospital does not have COVID-19. As we work hard to limit risk within this community, be reminded that it takes all of us doing our part. We continue to require the staff to take precautions, and I ask that each of you do too. Wear a mask. They are required to enter certain facilities and to participate in many services like village transportation. Masks must cover both nose and mouth. Also maintain appropriate distances, wash your hands often, and clean surfaces with a disinfectant. The virus remains very prevalent in the communities around us. To date, there have been 1,203 known cases of COVID-19 in Suwannee County since March. That is an increase of 121 cases since our update last Thursday. Please be vigilant anytime you are out of your home, whether on campus or away from Dowling Park. We also continue to encourage you to remain in your home as much as possible, especially if you have underlying health conditions. Do not feel you need to participate in any activities, but if you do, you must abide by the restrictions that have been put in place. Also be reminded that takeout options remain at the dining room, and the village grocer and the village pharmacy deliver. The facilities remain closed to non-members. Sadly, the virus is here, but if you continue to take precautions and follow the guidelines that have been put in place, you can reduce your risk substantially. Our success relies upon all of us working together. Your actions not only help you, but your neighbor as well. Please know that we will continue to work hard to address these issues while relying upon our loving Heavenly Father to see us through. Please continue to lift this community and those infected with the virus up in your prayers. As always, for questions pertaining to your particular situation, contact your service coordinator. During this time of increased cases, we will provide updates twice per week on Tuesday and Friday. The next scheduled update will be Friday, August 7th.